We're going to go ahead and get started with our session this morning. Good morning. I hope I can be heard in the room. It sounds like I can. Wonderful. We're so thrilled to welcome you to this morning's breakfast. My name is Kate Dodson. I'm the Vice President for Global Health Strategy at the UN Foundation, and it's our distinct privilege to be co-hosting this morning's session together with the governments of Costa Rica, Sweden, and South Africa, and also the World Health Organization. The session this morning is called Time is Now, Unlocking Ambition for Comprehensive Solutions for Pandemic Prevention, Preparedness, and Response. Every single one of those words matters for why we're here today. We should all have a sense of shared urgency. The time is now to make sure that we are better prepared to not only defeat the acute phase of this pandemic, but also prevent and prepare for future ones. We know those crises are looming on the horizon, and this is not the time for complacency. This pandemic has demonstrated so many fault lines and fractures in our collective capacities for prevention, preparedness, and response. And we'll talk today about a set of solutions, how governments working in concert with the private sector, with civil society, with communities, can increase the level of comprehensiveness, urgency, and importantly, solutions. So I'm really looking forward to today's conversation. We're going to have a couple of different segments for the morning. First is some opening comments from several of our co-hosting partners and others looking at the kind of larger landscape. We'll then invite Ahmed Al-Andawi, the Director General of the World Scouting Movement and the former UN Youth Envoy, to moderate two kind of fireside chat style conversations over the course of the morning. We hope those sessions in particular provide a forum for exchange, and so there will be microphones available to those around the room to add thoughts, ask questions, and we hope to spark a strong dialogue. So I'm going to first introduce our co-hosting government partners who are here represented at the minister level. And I will start with His Excellency, Mr. Arnoldo Andre Tinoco, the Minister of Foreign Affairs and Worship for the Republic of Costa Rica. Minister Tinoco, pleasure.
Good morning, Excellencies, panelists, and leaders from all sectors. It is of the utmost importance for Costa Rica to co-host today's discussion on strengthening the global health architecture and to commit to the prevention, preparedness, and response for present and future health threats. The COVID-19 pandemic and its sanitary, economic, and social effects force us to reflect thoroughly and seriously on available tools in order to seek better responses to the challenges at hand and in the future. We recognize that no country can do this on its own and that the international community must intensify its collaboration. Costa Rica is of the strong view that working on joint solutions is a moral obligation, but is also in everyone's interest as they benefit us all. In that vein, my country has advocated to recognize health not only as a human right, but as a true global public good. We have made important contributions to this paradigm shift, such as the creation with the World Health Organization of the COVID-19 Technology Access Pool. The road to achieve universal health coverage requires inevitably global conditions under the principles of solidarity, cooperation, and shared responsibility that enhance the possibilities at the national level to protect people's health. The recommendations presented by expert groups worldwide and the creation of an intergovernmental negotiation body to strengthen pandemic prevention, preparedness, and response within the context of the WHO has brought us closer to having an international instrument to face the future health emergency. Costa Rica is actively engaging in Geneva negotiations to ensure, among other things, that this international treaty incorporates a clear human rights-based approach, but also an agreement that enhances our shared responsibility over the access to and benefit from local production, transfer of technology and know-how, and implementation of effective countermeasures. And we are ready to engage equally in New York to put this matter at the top of the political agenda, because every minute lost will translate in more human suffering and loss when the next pandemic emerges. As we prepare for the negotiations of a high-level meeting on pandemic prevention, preparedness, and response in the General Assembly, I express the firm commitment of Costa Rica to work with South Africa, Sweden, and all member states, as well as all stakeholders, to achieve the maximum level of ambition on this agenda, putting people at the center of our concerns and actions. Thank you very much.
Thank you so much, Minister Tinoco. We are awaiting the minister from South Africa, but while we do, it's my very distinct privilege, in part she's already standing, which makes it easier, to invite Her Excellency Ms. Jenny Olsen, the State Secretary of Development Cooperation for the government of Sweden. Welcome.
Yes.
Good morning, everyone, Excellencies, friends, colleagues. As a co-host of this meeting, I would like to both warmly welcome you and also thank you for giving a priority to this discussion in this week with 1,000 meetings. So special thanks to South Africa and UN Foundation for leading the preparations. COVID pandemic 19 is not over. Last week, it killed over 10,000 people, according to WHO. We still have lots of work to do, not least to protect people across the world with vaccinations. But we also have an important task to prepare for the next outbreak of a disease with pandemic potential. And that work needs to start now, or actually yesterday, not when the next pandemic is a reality. We as governments need to invest in pandemic preparedness in our own countries, and we can greatly benefit from working through and with regional structures such as the EU and the AU, but this is not going to be enough. Equally important is to have a more well-functioning international system and effective collaboration at global level. This is a tall order which needs to draw on a multitude of efforts. I hope that the new EU Global Health Strategy, which will be launched this year, just before Sweden's EU presidency, will be one such contribution to both the regional and the global work. To effectively deal with the present and future health threats and emergencies, we need multilateral cooperation, and there is no other way. Sweden is pleased to see the decision by the UN General Assembly to hold a high-level meeting on pandemic prevention, preparedness, and response next year. This decision was widely supported, including by WHO Director General. Indeed, the role and the work of WHO is key and a high priority for us. As we all know, preventing and responding to health threats is not only about containing the virus, but also about ensuring access to good quality health services. The high-level meeting on universal health coverage next year will be important to that end. Looking ahead, there is need for political direction and support for reforms. Currently, there are a number of very important areas of work. Let me just mention a few. First, a pandemic treaty and a revised international health regulation, providing the rules of our common work, including a more effective surveillance and alarm system. Second, a further strengthened WHO with reformed financing as a means to ensure the independent and maximum quality in their important technical and normative work. Third, learning from the ACT Accelerator and COVAX, we need a pre-negotiated operational platform for the future to ensure more effective flow of vaccines and other products. Fourth, achieving sufficient and effective financing, both for preparedness and for response. Fifth and last, ensuring a high-level political leadership beyond the geopolitical tensions that we have experienced during the last year. A stronger multilateral system is essential, and the work and the role of the UN General Assembly. The Secretary General's Our Common Agenda report is one key point of reference for this. Ultimately, we need to invest in healthy societies which create opportunities for all people to live long, safe, and healthy lives. Thank you very much. Looking forward to the discussion.
Thank you so much, State Secretary. It's my very distinct pleasure to introduce one of our additional co-hosting partners, represented by its Regional Director for AFRO, Dr. Shidi Moetini from the WHO Regional Office. Welcome.
Honorable Ministers, distinguished guests, colleagues, ladies and gentlemen. It's a great honor for me and a great pleasure at this important event on behalf of the WHO Director General, Dr. Tedros, who unfortunately could not be here to welcome you to this important event. We're here to consider solutions to the critical issue of pandemic preparedness, prevention and response, and the urgency of sustained political leadership to meet the evolving challenges of the current and future pandemics. As we all know, infectious diseases do not respect borders. A threat to one country is a threat to us all. And the COVID-19 pandemic has exposed serious gaps in the global health security architecture. The inequities that we've faced in the past 2 years, or that we have observed in the past 2 years, for therapeutics, diagnostics, and vaccines, and protective equipment, I was just being told by my neighbor, undermined our efforts to bring COVID-19 under control. And speaking for a moment from the perspective and experience of the African region, which reports more than 100 public health emergencies every year, is a stark illustration of the depths of the challenge. These include outbreaks of infectious diseases like Ebola and monkeypox, and humanitarian crises like the food insecurity and rise in health risks in the Greater Horn of Africa. Now, well over 2 years into the pandemic, there have been multiple reviews of how to make the world safer, generating more than 300 recommendations. Building on these reviews and recommendations, and at the request of our member states, WHO earlier this year published a white paper with 10 proposals for building a stronger architecture for health emergency preparedness and response. The proposals include actions for stronger governance, stronger financing, stronger systems and tools, and a stronger WHO under the umbrella of a new pandemic accord. Our member states have affirmed that the international health regulations must remain a cornerstone of the architecture, supplemented by the new pandemic accord. As a result of the unanimous decision of the World Health Assembly special session, an intergovernmental negotiating body has now been established, it's been referred to by previous speaker, and begun its work on developing this accord. This is an opportunity for the world to come together to agree on a common approach with common rules for a common purpose and response to public health threats. At the second meeting of the IND this summer, member states agreed that the instrument should be legally binding, identifying Article 19 of the WHO Constitution as a comprehensive provision under which the instrument should be adopted and contain both legally binding as well as non-legally binding elements. This is a major step in WHO's view is that such a new instrument can only be truly effective in safeguarding future generations from pandemics if it is a binding accord that secures both individual freedoms and national sovereignty. As we work on the accord, we are already beginning to fill some crucial gaps. For example, through the new WHO Hub for Epidemic and Pandemic Intelligence in Berlin, and the WHO BioHub system for sharing pathogens in Geneva. In the African region, we are launching sub-regional emergency hubs to enhance coordination in Kenya, South Africa, and Senegal. Of course, no single entity will make progress towards global health security alone. It's already been said, and I'd like to emphasize it. We need collective action. We welcome efforts to accelerate coordinated action around pandemic preparedness and response, including a high-level meeting to which our WHO Director General has agreed. We stand ready to support our member states in the process of defining its modalities, including ensuring strategic timing and alignment with the IND processes. Preparing for and responding effectively to health emergencies presents one of the most pressing challenges facing the world today. We need to act urgently to ensure that these aren't allowed to undermine decades of social development and hard-won health gains. In closing, we seek your support and advocacy to ensure the successful negotiation of a strong, legally binding pandemic accord that truly serves the interests of all countries and all people. And as always, we seek your support to advocate for health as a fundamental pillar of sustainable development. I thank you very much for your attention.
Thank you, Dr. Moetti. It's my pleasure now to introduce Her Excellency Dr. Nadeli Pandor, the Minister of International Relations and Cooperation for the Republic of South Africa. Minister, welcome.
Good morning, everyone, and thank you very much, Program Director. Allow me to begin by apologizing for being late to a meeting that South Africa is co-hosting. I had to go through the most awful traffic lights, and then because I'm rather big, it took long to search me. So it proved to be quite a challenging morning. Nevertheless, I'm really glad that we had the opportunity to get here. So let me begin then by recognizing our distinguished guests, excellencies, ladies and gentlemen. And I wish to thank Costa Rica, Sweden, the WHO, as well as the UN Foundation for partnering with us to this important event. All of us would be aware, and I'm sure all speakers have said, that COVID-19 laid bare the inadequacy of our pandemic prevention, preparedness, and response systems. It certainly tested our sense of solidarity as a global community when faced with a once-in-a-generation challenge that knows no bounds. Today we meet just a few weeks after the adoption of a resolution calling for the convening of a high-level meeting on pandemic prevention, preparedness, and response, which was articulated during the 78th session of the General Assembly, which will be, we hope, adopted at the 78th session of the UN General Assembly next year. The outcome of that high-level meeting will be a declaration aimed at mobilizing political will at all levels for this very important objective. As South Africa, we look forward to working with all stakeholders to realize a successful high-level meeting. I think none of us would quarrel with the statement that we were certainly found unprepared. I recall the first 10 cases of virus in South Africa, and we thought, well, 10 in a few weeks, and then 3 weeks later it was over 100, and we realized we had a problem. And so we began convening as an emergency cabinet focused on COVID-19 and started to assess what we needed to do in order to respond. And I think one of the best decisions that our cabinet took right at the early stage was let's get the scientists to become part of cabinet. And I think that is what helped South Africa. We, of course, had one of the worst experiences of the African continent, and we still need to study why. It's probably linked to our burden of HIV and AIDS and tuberculosis. But the fact of government working with scientists and taking the advice of scientists seriously made a real difference. It was the first time I saw in our country that you had a professor of infectious diseases addressing the nation on a constant basis and explaining without using the terms of microbiology in very clear terms to the public what was going on and why they needed to follow the restrictions that had been put in place. But all of us were tested, and clearly there's a lot we need to do in order to be ready for the next set of health emergency challenges. Our own public health system, as with many others throughout the world, was definitely overstretched. And I think we all watched in awe as our heroes and heroines, the health workers, rose to the occasion and went definitely beyond the call of duty and responded to assist us to confront this emergency. I think if it were possible, the Nobel Peace Prize should go to all health workers worldwide for the period 2019 to 2021. Really, if it were possible, that's what I would say we should all call for. We meet today fully realizing that we may and probably will face similar pandemics in the future. Our discussion is intended to identify the key elements of a future pandemic prevention, preparedness, and response system. I wish to comment on some of what we think might be considered. Firstly, we are saying that leadership is key. Effective prevention, preparedness, and responsiveness requires a leadership that transcends narrow national interests and realizes that only by collaborating and working together can we address global pandemics. So from our own perspective, we put in place or agreed on a range of regulatory changes and public restrictions. But we became fully alert to the fact that as the party in government, we could not make these decisions alone, that we had to consult all political parties, that we had to speak to the different sectors. So if you didn't have the religious community behind you, you had those mad people arguing against vaccines. If you didn't have traditional leaders with you, you couldn't get vaccines to rural communities. So you had to have a wide sectoral engagement in order to ensure that all of us act in concert. So leadership, absolutely important. You can't, at that point of emergency, focus on narrow national interests, because this will definitely prove short-sighted and will prolong the pandemic. So we were really keen that we should engage and that everybody should be as informed as is possible as we become more and more informed about this challenge, because we didn't know everything. Secondly, our systems of global governance for pandemic management do require reform. We are really pleased with the ongoing efforts to strengthen the WHO, its systems and mechanisms. And we've been fairly vocal about our belief that we don't need another body to duplicate the WHO. We need mechanisms that fall within the ambit of this important body and work in close direction and coordination with it. We don't believe we need another institution, and I think we need to be very careful. I know we like to form institutions because it gives us a job and money, all of that stuff, but we think WHO is the premier global health body, and it has a repository of experience and skill that we all should draw on. We believe that WHO stood out as a beacon providing scientific and technical leadership for the management of the pandemic, and I think they did really well. For developing countries, WHO became the main source of sound, credible, and unbiased information. We knew that they weren't trying to rip off Africa when they spoke to our governments and our stakeholders. Furthermore, we need to build partnerships with and support regional mechanisms, such as the Africa CDC, for them to reach their full potential. Our Africa CDC was at quite its early stage of formation, but because it formed a very strong alliance with the WHO, it served Africa really well. And we've now cemented its sustainability under the rubric of the African Union because it played such an important role. And I'm really looking forward to us enhancing capacity within the African CDC to ensure that we build both the scientific innovation and human resource ability to react and respond when required. Third important point is that sustainable financing will be an important component for a successful pandemic prevention, preparedness, and response system in the future. The investment needed, we think, is small compared to the devastation that a pandemic of the magnitude of COVID-19 can cause. Probably from our perspective, we should not make all the alcohol companies pay much more money because we actually had to pause access to alcohol for some time to free up beds in hospitals. And the alcohol community took us to court all the time, but we were firm in our resolve and we freed up those beds and were able to treat real patients. So maybe the money lying within the alcohol sector can help us to respond to the problems that we have of financing. According to the UN, by the end of 2023, many developing countries will not have achieved the GDP growth they had before 2019. Jobs were lost and many businesses closed permanently. Thus, seriously investing in and funding pandemic prevention is in the collective interest of all of us. It will help us to save jobs, livelihoods, and businesses. We're encouraged by the efforts of the G20 in this regard with the commitments made at the latest meeting of the G20 in Bali, Indonesia. But we also realize that all countries and international finance institutions need to be part of the conversation on financing. If we don't solve the financing matter, I think everything we try will actually not result in success. Fourth and final point, vaccines work, they do work, despite one of our judges saying that they are the invention of Satan, they work. And they need to be distributed equally at all times. We need to boost, as a global community, manufacturing of vaccines in many more countries. We saw the cost that came with the dependence on only a limited number of producers located in just a few countries. So I believe very firmly, and we don't have this in my notes, we need to expand research and innovation across the world, particularly in Africa. If we don't address that, Africans will always be at the back of the queue of solution, and we can't afford that again. So investing in vaccine production is really important. We appreciate the governments and many stakeholders who have supported our call for a COVID-19 waiver, temporary waiver to the WTO TRIPS agreement. And we think that that first agreement, which is a term limited agreement on a waiver of access to intellectual property for vaccines, that we need to look at expanding it to diagnostics because it can't be limited to one part of what is in the production line and what actually assists in dealing with health emergencies. So we hope that when we call once more for a waiver, other aspects of diagnostics and other aspects that are relevant to responding to a health emergency, that everybody will support these calls, which are essentially about equality, about global solidarity, and about ensuring that no one is left behind. We believe that access to treatment is a fundamental human right, and it is one all of us to strive to ensure we achieve. So having laid out those 4 key elements that we believe should be part of the response, we look forward most sincerely to the exchange of views that will take place at this meeting. Thank you very much to you all for being here.
Thank you so much, Honorable Minister. What a powerful blueprint you've laid out for the global community, for the people in this room to help take forward. And I'm sure we'll be breaking down some of those themes that you brought up, some of those recommendations in the conversation to come. Before we close this opening segment, as I mentioned at the top, it's not only the responsibility of the public sector to engage on these issues, civil society, private sector certainly have a role. And it's not only important to think about preparedness and response, it's important to think about prevention. So with those things in mind, I'm really pleased to introduce Mr. Marco Lambertini, the Director General of WWF International. Mr. Lambertini.
Thank you very much, Your Excellencies, ladies and gentlemen. First of all, let me commend the co-host of this event. Super important topic, obviously, also for an environmental organization like WWF. And this is the angle I would like to present to you today, an environmental angle, or rather, a focus on nature-based prevention of pandemics. Pathogens has been with us for throughout our history and has been affecting our society with different scale of geography since long ago. And pathogens have been around for hundreds of millions of years, and we like it or not, they're going to be here to stay. So the discussion today, it was actually mentioned earlier on, is not only about COVID, which is tragically still ongoing, but it's about the next pandemic. And if you speak to biologists, I'm not a biologist, so you speak to biologists and ask the question about the next pandemic, the answer is around when, not if. It's a sober reminder that of our vulnerability that we have discovered tragically through the COVID pandemic, due to our interconnectedness as a global society, but also I think COVID has highlighted to us a number of other lessons. Was mentioned before, the solidarity has tested our solidarity, or rather lack of, perhaps in some cases, but it's also highlighted the interconnectedness between people and nature. And this is the point I want to highlight today. I think we are reaching a point where increasingly, whether it is about the stabilization of ecosystems or the stabilization of the planet, we're beginning to understand that we can any longer continue to take nature for granted, and that a wasteful, unsustainable relationship with nature bears consequences. COVID, other zoonotic diseases are an example of those consequences. Many pathogens are kept in check in many ecosystems around the world. when the ecosystem is healthy and balanced. But when the ecosystem, particularly high level biodiversity, tropical ecosystems are disturbed, something happens, the balance is broken. And that increases the exposure of human to pathogens. It's not a coincidence that of the last emerging infectious disease, human infectious diseases, 70% are actually a zoonotic nature, spillover from animals to humans. And that in the last 20, 30 years, about the occurrence of this zoonotic disease is tripled into this. That's a warning signal about the pressure that we're putting on ecosystems that unleash and expose us more strongly to infectious diseases. Deforestation, sustainable likes of farming, encroaching in natural ecosystems, wildlife consumption, wildlife trade, intensive farming, unregulated and unsustainable. But you can look at this negatively with an agenda of curbing deforestation, curbing wildlife trade, curbing intensive farming, or a positive agenda, which is what I would like to do. Promoting a nature positive and sustainable forest, sustainable consumption of proteins, including in a regulated way, wine sources as well. This is an agenda that needs to be the forefront of a holistic pandemic prevention approach. Because if you like, perhaps, I like to think that a nature-based pandemic prevention plan is sort of the earliest opportunity we have to avoid the next pandemic. And of course, on top of all the rest that you mentioned earlier on, which is super important. There's no a super bullet, but it's a combination, it's a holistic plan. And so we would urge leaders and all of you involved in the health system, and that we ensure, of course, as the leading organization, to include nature-based pandemic preventions in any plan, in accord, any measure that is intended to bring the world together to face much more particular pandemic. At a time when we're finally beginning to understand that nature conservation, respecting the balance of the planet, is not just a moral duty towards the pandas, or the elephants, or the tigers, is actually a question of human security, and it's fundamental for the future of humanity. Thank you very much.
Thank you, Mr. Lambertini. We're running a bit behind, as is almost always the case in these events. So I'm going to rapidly introduce Mr. Ahmed Al-Andawi, the Director General of the World Scouting Movement, to come up and introduce our first panel. So first panel, please come up and take a seat with us, and we'll go ahead and get started. And again, everyone join me in thanking our opening segment speakers.
So very good morning to all of you. How are you this morning? Well, it doesn't have to be boring because the CGA can be wonderful to see you all. Thank you so much for showing up this morning, Madam President. Well, thank you so much. My name is Ahmed Al-Andawi. I serve as the Secretary General of the Scout Movement, and I'd like to think that they invited me to moderate because fireside chat is a scouting term. Even before President Roosevelt probably started that series in radio. So, but in addition to that, in fact, the scouting was stepping up to respond to the pandemic by teaming up with some of the leading youth organizations. And I think if there's one meaning for to moderate today is just to show about how many other actors that would never show up in a technical conversation are showing up today, because this is no longer a story that needs to be dealt with in one sector or by a bunch of experts. I think we all find ourselves thinking of ourselves as experts and having really massive stake on the the question of how to avoid and be better prepared for the next pandemic. So in this session, we'll have the pleasure of honoring excellent speakers. I'll be introducing one by one, starting with you, Madam President. Madam President Ellen Sirleaf, former president of Liberia, and a big champion of effective multilateralism. Can I start with asking you, because a guy like me is super confused. I've been following everything that we have been saying today, from how to ensure that we are much better equipped and much smarter in the next pandemic, how we can, whether through the accord with WHO, the interests of G7 or G20, the high-level discussion we'll be having at the General Assembly, and lots of conversation being had today about how we can be better prepared for the next pandemic. From someone who has followed it closely, how to make the UN better fit for purpose and in a better shape to respond next time. What do you think? What's your recipe for a better response, a better multilateral system? And is less is more? Do we need less processes or more?
Thank you. First, let me say a big thank you to those who have organized this, with particular thanks to the governments of South Africa, Costa Rica, and Sweden that have been very persuasive, very determined in moving forward on the report of the independent panel for pandemic preparedness and response. Many may recall that when West Africa faced the Ebola in 2013, there was a report. That report was headed by President Kikwete of Tanzania, and recommendations were made to ensure that there would not be another pandemic. Those recommendations were not implemented, at least not in full. And then we formed the independent panel that, based on some of those recommendations, but looking forward, looking at evidence-based of what scientists have determined, came our report to make sure that we could, that the world could take action to prevent another pandemic. I believe the Minister of South Africa listed so very well the essential elements of that report: leadership, the strengthening of WHO, adequate financing, ensuring that we had the existing bodies carry out the function. But all of this is determined by the leadership and the political will to take the action that's necessary. And this is why we are here as strong advocates for this. But if I may add one thing not stated, is that no matter what you do, no matter what institutions are strengthened or finances are mobilized, unless national healthcare systems are enhanced with what it takes to be able to respond at that level, and unless we can equip those who are the front runners in identifying and responding to the disease. And so I'm very glad that we've worked with the African Union to be able to promote support for community health workers, to ensure that they have the training, that they have the recognition, and they have the resources to be able to respond. But we're very thankful. We're hopeful that as a result of these meetings and the great work done by South Africa, Costa Rica, and Sweden, supported by the UN foundations, that we will see action on the report of the independent panel, and that we will see how those measures are taken. We hope that there will see a political body that's very diverse in its constitution to be able to exercise the political will, to see that those recommendations are carried out, and to see that there's monitoring of the implementation so that we can see that we can prevent another pandemic through the result of collective action. So much required at this time when we find the failings of global cooperative action. Thank you.
Thank you very much. I'm going to Ms. Joy Fumafi, and I can say officially congratulations. I think this morning we've been announced as the incoming co-chair of the Global Preparedness Monitoring Board. And I guess my question, can you tell us more about the board and where it fits, I mean, in the broader conversation around ensuring we're better prepared to respond and to prevent future pandemics?
Thank you so much. And I want to thank our gracious hosts for inviting us to motivate the action that Her Excellency has talked about, that Honorable Minister talked about, that the representatives, that all our hosts talk about, the action that is necessary for us to be better prepared for the next pandemic. Now, the Global Preparedness Monitoring Board was actually established after the last Ebola pandemic. And it published its first report in 2019, just weeks before the COVID-19 pandemic hit. And the board predicted at the time that there was an immediate threat of a major pandemic. And we are continuing to predict that even now, that we are still in danger of an immediate threat because we are not prepared. And we have all learned today about the lessons that that COVID-19 has given us, and the breadth of multiple sector engagement that is indicated in preparedness for the pandemic. So the role of the board is to advocate for the role of independent monitoring in providing oversight on progress and ensuring mutual accountability multi-sectorally across all sectors and engaging all stakeholders, highlighting the most urgent actions for preparedness and ensuring progress towards a safer world. We are all honored, myself, my co-chair, and members of the Global Preparedness Monitoring Board, to have been given this opportunity to lead this essential work. But what is equally important is that we have now seen it necessary, because of the importance of the multi-sectoral nature of pandemics, to actually expand the board and ensure that every stakeholder, every sector is represented on the board, whether they are going to be national actors or international actors. One of the biggest issues that have been addressed this morning is the question of what is required at country level. Of course, we welcome the news that a One Health perspective is necessary, that WWF talked about. We also welcome the opportunity for a summit next year, but we feel that before we get to that summit, we need to understand country by country what we need to do to prepare. We urgently need to ensure that everyone in society, including the most vulnerable, are engaged in the preparedness and response. We need transparent mechanisms that can hold governments accountable for the investments that they make to combat the old challenges, even including corruption, and address the social determinants of health in order to ensure that health outcomes are equitable, even in the process of pandemic preparedness and strengthening of health systems. We need one coordinated strategic plan that everyone in society will align with, and that we can therefore use as a platform for holding people accountable. We need to factor into that a humanitarian and conflict context and make sure that the UN summit addresses preparedness at the highest level, but including all the factors that are going to be either triggers for a pandemic or that will inhibit our ability to respond effectively to the pandemic. So I will not address all those sectors because I think they have been addressed effectively this morning. But we look forward in the Global Preparedness Monitoring Board to working with all of you in order to make sure that the next pandemic has a much lesser impact on all of us, and that we do not continue to be as vulnerable as we are today.
Well, thank you very much, Joy. I mean, to wish you all the best in this important responsibility. I mean, over to you, Ted Chavan is the global lead coordinator for the COVID-19 vaccine delivery partnership. It's fair to say you've been at the front lines almost of this massive operation. What are your reflections?
So a couple of points. First of all, thanks, Ahmed, and thanks to the organizers of this event. We were asked to focus on the countries that didn't have an opportunity to vaccinate their population. And you need to recognize that when the vaccines were needed in 2021, they were not available, as the South African ministers told us. And most of those countries are countries that are facing either humanitarian emergencies or conflict or have stretched health systems. And what is clear is the importance of focusing on health system strengthening in a systematic manner in those settings, with a focus on primary health care and paid community health workers. And this is key. We often think of ourselves in those settings as having annual funding cycles from the budget or from humanitarian pots, but you can have a multi-year perspective and systematically work at building those systems. I hope one of the legacy of this pandemic response is to really focus on paid community health workers. Second, much more focus on not just working with government, but national institutions, NGOs, CSOs, the role of faith-based organization. 1/3 of the health system in DR Congo is run by faith-based organizations and Red Cross, Red Crescent societies. Really work with those institutions so something is left behind and something is there for the next pandemic we're dealing with. And then third, it's often felt in this response that humanitarian actors are continuing with their humanitarian responses, and then the pandemic responses on the side. We really need to bundle or integrate those activities, have a package of services that brings COVID-19, in this case, whatever the future pandemic is, response, and key activities. Omicron changed risk perception. In many of these places, you're dealing with populations that are dealing with malnutrition, yellow fever, malaria. Put these things together so that there's a package of activities. A final point, Ahmad, the architecture. Any operational platform that is there to deal with pandemic needs to be anchored in the multilateral system led by WHO, but it also needs to build on coordination mechanisms that exist, and specifically in humanitarian settings, link up with the humanitarian coordination system and the cluster system.
Very well said. I mean, let me invite from the floor Right Honorable Helen Clark, who needs absolutely no introduction. We all know them very well. And probably my question, building and reflection from the panel, do you think the recommendations of the independent panel have been sufficiently effective and has really continued to guide the next leg of this conversation and what seemed to be a very busy next 12 months for all of us?
Well, I think the recommendations have been marvelously reflected in the contributions this morning, and I was privileged to work with President Johnson Sirleaf very closely over quite a period of time now on those. I think what I want to say is there's really a sense of urgency here. It's been stressed again and again this morning that we're not any better prepared actually for the next pandemic threat, which could be next week, next month, when it's not going to be 100 years away. So one of our key recommendations was to hold a high-level meeting. It was to have a strong political declaration come out of that. We think that of all the different tracks of work that have come following our report, there's one that's still missing, and that's the leadership track. And South Africa stressed that, others have stressed that, that we do need leaders involved at the global level to push this forward. We know the difference leadership made at the national level, where leaders didn't lead, it was disastrous. Where they did, they got better results than they would have otherwise. So we would hope that the declaration will reflect a high-level threats council. As others have said, President Kikwete's commission recommended that, it didn't happen. but someone has to keep the sustained momentum going for this. Otherwise, we go back into the cycle of panic and neglect. We're already into the neglect cycle. How many are talking about COVID now? You know, I'm seeing hashtag COVID is not over as a pushback against that. But we have to seize the momentum of the opportunity of the high-level political meeting to drive forward on mechanisms that will keep this issue on the front burner and never let it go to the back burner again. Thank you.
Thank you so much. Very well said. I wonder if we have with us here Natalia Cannon, who's the Executive Director of UNFPA. Oh, here we go. Natalia, great to see you. I was looking for
Great
you.
to see you. Thank you. And thank you to the amazing panel and to the openers. Agradecimiento también Costa Rica, Sweden, South Africa. Thank you. Helen has made the point about leadership, and I would like to stress that there was a gender dimension to COVID, and women were not asked, and women are 70% of the health workforce, underpaid, midwives who were trapped in the lockdown situation couldn't get to the pregnant mother. So when we think about gender, we also have to understand that women in communities are capable of leading, but the space has to be made not just open for invitation, but they need to be listened to once they are at the table. And so much flows from that because women are decision makers in the household, and that should be reflected in the politics of how we attend to the pandemic. Now, as an epidemiologist myself, as a doctor myself, data and disinformation. This is something that Madame Kumafi has also been in the leadership of the research that is relevant and to counter the disinformation, as Tedros and Dr. Chidi and so many others had to do, because if the woman doesn't believe that this vaccine is beneficial, she is not going to access it. So I will limit myself to saying that for UNFPA, the Sexual and Reproductive Health Agency of the United Nations, we intend to advocate for young women to be protected, for preparedness and the response to involve young people. And I've already declared I put all my trust and faith in that generation. Thank you so much.
Thank you so much. Thank you so much. We will be taking to another perspective from member state for the Deputy Permanent Representative of China, the diving back row because that's the mic.
Thank you so much. At the outset, I wish to thank South Africa and Sweden and Costa Rica for hosting this event and commend the insightful presentation by the speakers. A few days ago at the General Assembly, the Secretary General said that we are facing, I quote, a global pandemic that refuses to be defeated. And the emergency of another health emergency is monkeypox. So I end up the quote. So indeed, the COVID pandemic is not over, as the South African minister said. We are still losing more than 600 lives to COVID every day and around the world. And more than suffering the long COVID, every life matters. So we should not give up. We must try our best to end the pandemic by two ways. One is to reach the 70% vaccination target set by the WHO. The other is to effectively implement the test to treat strategy, including equitable access to antivirus treatment. So no one should be left behind. The COVID pandemic is not the last one, for sure. In this regard, pandemic prevention, preparedness, and response is crucial. We should enhance the public health capacity building, especially for developing countries, and strengthen international architecture for health emergencies, with the WHO playing the leading role. China is a steadfast supporter to the global fight against the pandemic. We have launched the largest emergency humanitarian operation in history, and providing more than 2.2 billion doses of vaccine to over 120 countries, mostly developing countries, and billions of testing kits and protective gears to over 200 countries and regions. We have also donated $100 billion to Gavi and COVAX, and we will continue to our contribution. I thank you.
Thank you, Dr. BPR. Just to close by mentioning Gavi, so let's invite Ms. Ana Maria Vitar from Gavi for additional reflection.
Good morning, everybody, and thank you, Sweden and South Africa, muchas gracias Costa Rica for the invitation to Gavi. I think after all the amazing insights that have been shared, I would like just to plead for three things: equity, solidarity, and accountability in this new global health architecture that we are all building. Equity because it needs to have this new global health architecture a laser focus on equity, reaching the most marginalized, bringing civil society, and having a picture of the world that is not going just, grouping countries in GDP categories, but it's really going to encourage the participation of every country, regardless of the GDP status, in the building up of this new global health architecture. Community health workers and stakeholders have also been raised, which are absolutely essential because of the many barriers that affect marginalized communities, especially gender and social and economic issues. Accountability because I think we need to put PPR in the context of the multilateral system, and we cannot fail more and more. We are looking at the SDGs, and when you see the figures, it's really to cry. No, we are not going to meet that. And so anything that is built needs to have a robust accountability system that can really measure and put pressure on every one of us to fulfill what we promise. And solidarity because in that equity we need to also help. For instance, vaccine manufacturing in different parts of the world, in different regions. At the moment, that is supporting the African Union on building that, but also a capacity to respond. Focusing on that, I think we, just to finish, need also to rely on interventions that have proven to be effective and reaching the most marginalized, as immunization, for instance. So thank you very much.
Thank you very much. I mean, we're behind with time, but I'm just keen to come back to you, Madam President, for any additional reflections or thoughts, having heard a number of speakers from the floor.
I'll just be very quick and say that if we were looking at the key actions, political will at the national level, cooperation through effective multilateralism at the global level, a very coordinated effort through the World Health Organization, scaled resources to ensure that we can meet the requirements of building new health systems, and finally, equity for the global South to ensure that we're able to come up in the preparedness and the responses necessary to ensure that there will not be another pandemic. So Helen Clark and I will be advocating these throughout the weeks that come, and we're looking forward to the coordinating group and the working meeting in next year's assembly to see if we can get the political declaration for implementation of the recommendation of the independent panel for pandemic preparedness and response. Thank you.
Thank you very much. Thank you. Very quickly, Madam Commandant, I can ask you the same question. It seems there's almost a consensus over what needs to be done. So where we go from here? I mean, several speakers said we need sustained political commitment. What's the advice? And I think I heard a speaker from WHO asking all for clear advocacy homework for all of us to take forward in the coming months. What's your ask of the audience here?
Thank you so much. My leader, President Selig, has already said what are the various elements that should be addressed. But what do we do when we live here? When we live here, I think the first thing we must appreciate that we have created an organization called the United Nations. And we have within it an organization called WHO that is responsible for global health. And we are the United Nations, we are WHO. We have to empower this structure to deliver for us in preparing for the next pandemic. We are going to have a summit next year for the leaders of the global community. That is, but we need to prepare for the summit. So we have a responsibility. We go to our countries, we go to our organizations, work under the United Nations, with the United Nations, to ensure that everybody is involved in preparing for the summit. All stakeholders at country level, whether they be religious leaders, community leaders, the various stakeholders that we addressed here, the women that we talked about, they must all be engaged in this preparedness. Let us get the scientists so that by the time we go to the summit next year, we have made more progress on the science of risk focusing for pandemics, because we have not made enough progress in that area. We need to be prepared, yes, but science must lead the way. Is the biggest lesson that we have learned from the COVID pandemic. So scientists, get back into your expertise and make sure that risk forecasting for pandemics is at a much more advanced stage than it is for the next summit. We have a lot of work to do to prepare for the summit. So let us go and do it now.
I think that answers a clear final words.
Very quickly, the president spoke for all of us, but just 2 points. Firstly, we need to stay the course on the current response. We're still in the midst of a pandemic. And secondly, a lot of work needs to be done on preparedness and health system strengthening with a focus on low and lower middle income countries. We should not waste the time we have to be prepared for the next time.
Well said. Thank you very much. President Joy, thank you so much. Let's give them a round of applause. Thank you very much. Invite the second panel, the speakers to come on stage as well. For the second panel, we'll have Dr. Magda Rabab, Managing Global Director for Women in Global Health, and I'd like to also invite Mr. Stanley Bergman, Chairman and CEO of Henry Chin, and Ms. Feya Paso, who is the Head of Secretariat of the Financial Intermediary Fund on Triple PR of the World Bank. Please join me. Okay, well, let's start. I mean, this is about where's the money, I think. This is about unlocking the resources and the investment needed. And I mean, let's start with you. I mean, sharing your thoughts. I think it's the agreement was emerging in the first panel about the need for investing, not replicating what's already existing in the current structures, supporting the WHO and continue building the recommendations of independent panels. So when it comes to financing, how we can approach that?
I think the World Bank will tell us a bit more about the financing. I'm going to talk about another important resource, which I think, even with all the money that we may have, if we don't invest on them, we will not be able to have resilient health systems. I want to talk about human resources. I think the missing link in all the conversations has been how can we prioritize and invest adequately on human resources so that we build the resilient systems we have been talking about. There is no system who's going to be resilient without adequate health systems. From the past, if I take the example of the HIV/AIDS emergency, we realized that we didn't have the capacity to face the challenges and the demands, the needs created by the emergency caused by HIV/AIDS. We came up with several strategies. One of them has been, for example, to do task shifting, because we didn't have enough human resources to do the job. Task shifting was a popular and very attractive initiative, but it didn't take us far because it was a sort of a band-aid for a huge problem that we had. And we worked more seriously from that time to really fix the human resources problem. We will not be sitting here today with a gap of 15 million health workers in order to achieve universal health coverage. We would have not been sitting here looking at how devastating the pandemic was just because we didn't have adequate human resources, trained, motivated, supported with decent working conditions. We have seen health workers working without PPEs, without all sorts of supplies and tools that you can imagine. So there is not a way for us to be better prepared for the next pandemic. If the debate, the conversation around human resources is not left, right, and center. Part of that is, or center to that conversation is the fact that 70% of health workers are women, and women have been left behind. Natalie Panett from UNFCA has just reminded us of the gender dimension of this pandemic. Women are unpaid, poorly paid, not benefiting from positions of leadership. When you have 70% of your health workforce delivering healthcare, but 25% only of them in positions of leadership and senior management, do you have a problem? Healthcare is delivered by women, led by men. We really need to address the gender dimension, but put focus and emphasis on recruiting, training, motivating, giving decent working conditions for health workers. There is not going to be preparedness without human resources.
Well, I think the question of human resources is critical. I think you probably, if I can share what you just said as a question to you, with the new fund, I mean, what kind of investments you are looking to make, and looking both at the human resources element, but more broadly, I think that will be coming also about the very difficult circumstances where health workers have been operating under, and how we can avoid that next time.
Well, thank you very much, and thank you also to the organizers. We've had very inspiring, motivating panels before, and so I'm not going to repeat what they said. I would just say I fully agree with the call to action that was raised by the distinguished speakers ahead of me in the earlier panels, and I think strong human resources, a strong health workforce is really the cornerstone of resilient and adaptive health systems. And so, I couldn't agree more with you. This new fund that I'm happy to announce is now established. It's a financial intermediary fund for pandemic prevention, preparedness, and response, hosted by the World Bank, that we've developed in close cooperation with the World Health Organization. And in partnership with now 22 donors, both national governments as well as philanthropies, is now kind of has been set up. It met for the first time 2 weeks ago, and
it is, it is a very exciting new opportunity, providing a dedicated stream of financing for pandemic prevention, preparedness, and response, focusing on keeping the attention in interpandemic years on this important agenda so that we don't fall into cycles of panic followed by neglect. The fund will focus on all of the key elements that are needed to prepare the world for the next pandemic. We've estimated at the World Bank, working jointly with the WHO, that about $30 billion of additional investment is needed in low and middle income countries over the next 5 years to prepare those countries for the next pandemic. And of that $30 billion, about a third is likely to come from external financing and 2/3 from domestic financing. So about 20 billion additional from domestic, and then 10 billion from external. And this fund is one part of the solution. It's not the solution, it's one part of the solution. And it will focus on all of the important areas that have been mentioned earlier at the country level, on disease surveillance, on laboratories, on health workforce strengthening, on investment in key medical countermeasures like vaccine, therapeutic diagnostics, so that the world is not faced with the kind of inequities in terms of access that we witnessed in the wake of COVID. The fund will also, potentially focus at the regional level to strengthen regional organizations like the African CDC and other regional organizations going forward. So, there are a lot of opportunities to invest. The way it's going to work is that it will issue calls for proposals from time to time, and the proposals will hopefully be strongly anchored in national action plans for health security, so that the fund can help strengthen the capacity of countries to become more prepared, but also strengthen the capacity of regional organizations, and finally focus not just on preparedness but also on prevention. So taking a one health approach. So that's
it's a very important idea. I mean, it's a very important facility for sure. I mean, yeah, but ask you, Mr. Bergman, about partnerships and public-private partnerships or multilateral partnerships involving also some of the multilateral institutions. What's your view on that, and what do you think should be done in the body of work we have over the next year or two? I mean, on strengthening the whole global response to future pandemic.
So let me thank Costa Rica and Sweden for convening, but above all for South Africa. And Ambassador, thank you for inviting me on this panel. My company, Henry Schein, is the largest provider of products and related services to physicians outside of the hospital, nurses, paramedicals, dentists. We're a significant provider of PPE. And the discussion here today is terrific. I admire a lot of work that's being done. But if manpower is important, and it is, and there's been discussion here that 70% of the manpower provided for woman power is by women. I just wanted to make a blanket statement to you today that the PPE supply chain is not fixed. If we have another epidemic, forget pandemic, we will not have the PPE in the right place at the right time. There's no convention that requires countries to ship PPE. We had situations in the EU where we were not allowed to ship product from one EU member to another. In North America, we were precluded from shipping to Canada, and the Canadians were precluded from shipping to us. The system is broken. Unless we get a convention, we're going to end up with the same situation, which is jump ball. Whoever takes bags of money to the countries that manufacture the PPE, one country, 70% of the world's masks, another country, 7% of the world's gloves. Unless we figure out how we're going to deal with this, the rich will get the PPE and the poor will not. There will be PPE floating around the world that doesn't work. We have plenty of that today. And right now, we don't have warehouses big enough to stockpile. The stockpiling doesn't work. We need a supply chain that is going to respect humanity. And man, in your case, 70% are women. These same women will not get access to PPE unless we do something now. In 2015 at the World Economic Forum, President Kim convened a group of people. We established a pandemic supply chain network, a public-private partnership. We did some work. We did help in March of 2020, but still today, governments don't recognize that this little product, PPE, which is a fraction of the cost of making a vaccine, is not dealt with.
Who would like to react to that?
Yes, just to add a little bit on the PPE issue. Probably most people don't know that the PPEs are produced on male standard size, and they don't fit majority of women. So this is another issue to be addressed. And I think we need to work on it. Thank you.
Well, you have that, but this what you said is a reminder. There's so much for future that I mean, when we respond to crisis, well, all the restrictions and aiding other countries in need. I think I heard the minister of from South Africa talking about should avoid a narrow national interest. And I think my issue that would be, I'm not sure they can be even called national interests when it comes to health. It can be narrow. I mean, that's what we realized from the pandemic. They're not national interests in the first place. And I think that's what we learned in the pandemic response.
Pandemics don't have visas.
Here we go. I mean, and so just as a suggestion, I think it's a very short-sighted way of looking at the response. Let's go to the floor. I would like to invite Ambassador Stéphanie Thibault from France to make an intervention from the floor, Your Excellency.
Thank you very much, and thank you for the invitation to this wonderful event. And I think a lot of what is being said around the room is really, well, helping us remain extremely mobilized on this. I want to go back to what Dr. Magda Robala said about human resource. Not our belief in France, definitely our president is behind this vision, is not only that without tackling the human resource issue, we will not have preparedness. It could also be the best and most practical way to actually tackle that. One of the issues we have with preparedness is that it is, well, we heard the figures that Priya gave us. It's a lot of money, and it's a lot of money for the future. So in some ways, it's like paying insurance. Everybody wants to do it, and you always hope that you're going to be okay, just tagging along as you always do. And so the whole issue is trying to make this longer term investment in preparedness relevant today. And investing in human resource is relevant today to leaders, political leaders around the world. And financially, it is possible to tackle this issue bit by bit. And I believe that if there is indeed a determined plan to help or for countries who want to take responsibility and address this issue, and I'm talking about all countries, I'm talking about my own country. We do have the same issue of missing health workforce as most countries. I think it's the WHO that came up with the number of 7 million missing health workers, and that was last year, and a forecast of that figure being doubled by 2035. So really, this makes so much sense. It's such a pragmatic investment. Invest, as Magda said, in the training, in the working conditions, and in the decent salary for the workforce. There'll always be a return, and that is something that can be done today and makes political and financial sense today, and will bring and can bring us along the longer term vision of preparedness. So this is what I want to say, apart from the fact that, of course, it is a feminist, there is a definite gender feminist perspective to this. And one has to wonder why it is that most health workers in the world today are women, and why many of them are unpaid. But
thank you so much. That's really important. So if I can come to you this speaking and ask, I mean, the new fund that we're trying to leverage, and you mentioned the 2/3, 1/3, but I think the question to someone like me, are we talking about redirecting funding and resources? Is this coming from the official development assistance, or are we looking at actually new, fresh commitments being made to increase them? and how all of that would impact. I mean, nobody's talking about, I mean, the word SDGs were not mentioned even once today, because I think that tells us about the competing way of looking at these things, and we're still struggling there with that financing of the SDG bill at the national level. So how you would look at that, at the question of unlocking additional resources, not redirecting all the pledges.
Absolutely. So the goal is to mobilize additional resources, not to redirect resources and kind of shift things around. So the goal really is to mobilize additional resources and to mobilize resources from non-ODA sources as far as possible. You know, at the wholesale level, to grow the fund in that way, but then also to use the dollars that the fund has wisely, so that with every dollar that the fund provides, to use that as a catalyst for you know, kind of resources, investments that countries themselves would put in, or investments that you know, the private sector may want to put in at the project level. So there are many ways to think about these resources that on that will mobilize resources, and there our aspiration is to mobilize those from non-ODA with additional sources, and then in the way the fund deploys the money into projects, we hope to, you know, to ensure that there will play a catalytic role.
If I just go briefly to you, Mr. Berman, and ask you, do you think in the negotiations that were seen to the end, the process both and the World Health Assembly or the potential accord, do you think the private sector or the companies that the world relied on to try to find a quick fix or kind of a catch-up solution for the response to the pandemic, are they sufficiently reflected in that discussion? Do you have any influence to be part of that discussion?
I think the only way to really solve these issues is through public-private partnerships. I think, of course, bringing vaccination through the approval process was a tremendous public-private partnership. But that the private sector drove it with government money. I think on the public health side, to a large extent, the multinational organizations are driving it. Of course, consulting with the private sector. I'm worried that on the supply chain side, there just isn't a will by any of the parties to solve this thing. And I'm really, really worried. Well, I'm talking about a pandemic. I'm talking about a mini Ebola, and we will not be able to get the product to these countries. It took, in the Ebola situation, I think it was President Obama sent a few planes over, but that was great, and we got some cleaning solutions over. But if we don't deal with this thing right away, we're not going to stop this. And the only way to deal with this is through public-private partnerships.
Do you think there's mistrust there?
No, I think when people get into the room to work, it happens. And the vaccine happened because a couple of companies said they're going to do it. And moving our healthcare workers around, I think that works because of collaboration amongst certain institutions. But I don't think it's so much a trust, but it's the will of somebody to convene it. And it can't be left to the private sector. We can bring tools. We don't have the credibility that multinational organizations do. And we need multinational organizations. In the case of the pandemic supply chain network, it was the World Health Organization and the World Bank that convened us. But that was 2015, Ebola came and went. Now we don't think about Ebola anymore. So that group is just not that active.
Yes, just going back on the issue of the money, I think the fifth is a good response to the problems we are facing, but as it was indicated, it will not be enough for us to resolve that. There will never be enough money, but I think we need to make better use than we have. We have initiatives like the Global Fund, the PEPFAR, the PMI, the Gavis, and whatnot of this world. I think it takes more strategic, more intelligent, and more assertive way of coordinating, because all these initiatives, they have a component on health system strengthening. If they don't, they can be reorganized, reoriented, so that we focus on what's the priority of the moment, which will serve developed and developing countries alike. I think it will take resolve, it will take determination to take leadership for us to put our fingers on those strings that will make a difference. Not everything is going to be tangible in terms of being a box or anything. Sometimes it just takes goodwill around the table for multilaterals, private sector, civil society to work together and then leverage what is already available. And like Stephanie said, we need to be aware that this is going to be a long-term investment. We can't fix the human resources or even the preparedness, the labs and the networks that we need overnight. We need to be committed to a long-term investment if we want to be prepared for and tackle the next.
Yeah, no, if I can just add, so I fully agree with you, and this is an intergenerational challenge. We need to produce some quick wins though, but we need to stay focused, over decades. And I think one of the challenges has been that, the reason why these investments haven't been made is because the visibility of these investments is low. Governments have short-term horizons, right? 3-4 years. So, this has to be kind of sustained investment over the long term. And you've got to be prepared that the benefits won't show until pandemic hits. And even then, if you're well prepared, you don't realize, what the cost could have been. But I think this pandemic, while it's so fresh in our memory, and as I said, it's not over yet. This is the opportunity to really kind of capitalize on the moment and make those investments and start those investments and ensure that those investments are sustained over time. I just want to make one more point, which is that, as you were saying, there are so many global health institutions right now that are doing really good work. The Global Fund, there's SETI on vaccines. There's on vaccines. There is the World Bank itself, which is a big investor in pandemics to our IDA and our DRD, other multilateral development banks, of course, the UN organizations, WHO. So this idea of this fund that I just spoke about, or this reality now of the fund, it's not going to replace the existing institution. The idea is it channels money through existing things, right? So it's just a new source of dedicated funding that will leverage all the capabilities and strengths and the comparative advantages of existing global health institutions, channel money through them, work with them, UNICEF as well, work with these organizations, process the money so that they can do more, and more focused work on pandemic prevention in this market.
Thank you very much. I think it's a very important conversation. It's an important touch point, I think, for all of us. And I'm hugely encouraged by how much it seems there are convergence of views. I mean, it seems there is a clarity of what the to-do list looks like in terms of what needs to be done. The commitment to the independent panel recommendation is still there. I think the ask that has been made about sustaining the political will from now for next year and having that moment at the UN General Assembly next year, but even more so, I would say, and looking at the discussion at the World Health Assembly and the process that is ongoing there. I think that's of key interest to all actors. Is very important to keep this alliance being built. So I would like to thank very much Sweden, South Africa, and Costa Rica, the WHO, and the UN Foundation for allowing this conversation. I know this would be at a much bigger momentum for next year, but I thought it was fitting for all of us to review and be here, so we'll be able to have that discussion. To give us some closing remark now, it's my pleasure to invite Ambassador Matthew Tueni, Permanent Representative of South Africa to the United Nations in New York. Your Excellency.
Thank you, moderator, and I'm fully aware of the time, and I'll try and be quick. I really wish to thank the ministers of the 3 countries that are sponsoring this event, also, and for the opening remarks, but equally the very helpful remarks of Dr. Matsidiso Moeti and Dr. Makola Butini. And a big thank you to the UN Foundation and WHO, our partners, for their meaningful contribution to this morning's event. We couldn't have done it without those 2 partners. I also really wish to recognize the presence of the Right Honorable Clark. We are happy that you could join us this morning. It was the objective of this session when we conceptualized it to get all of us in the room to hear from our political leaders, but to get really inputs from our experts on the issue of pandemic preparedness and response. And I'm sure you'll agree with me that our distinguished panelists have given us rich inputs and food for thought, but even more concrete issues that we need to address, enabling us to really achieve the objectives that we set for this particular event. And I'd like to ask you to give them a big round of applause, please. So thank you to our panelists. And I think the key message that came through, and I think you touched on that, the convergence in the room, and the fact that we need to put this issue at the forefront, as the Right Honourable Clark said, until the next meeting, and the centrality of the financing issues, some other interesting issues that around human resources, around including women and girls, the equity, solidarity, and accountability that was mentioned, all mentioned the importance of leadership. And I believe that we can count on the three countries that are the co-sponsors, that are the political level, member state level, these three countries, plus the other co-sponsors that will work with us on that resolution, will be behind this issue. And let me really, I also realized that there were concrete suggestions that were given as we moved towards the high-level meeting that we had moved for. So these suggestions are really quite welcome. Let me end by thanking you, our wonderful audience in this room, but also in the various platforms, for your presence and engagement, and also the points that we had from the floor that just brought more richness to the discussions. And lastly, thank you for deftly managing this study challenges that we had and bringing this to conclusion. Thank you very much. And we wish you, all of you, we wish you well, and we will be partnering together as we move towards the summit.